I'm getting your workout today. So typically I will straddle the table. I'll have the child just, and again, I'll make it a game. Make it as much of a game as you can. In fact, sometimes I'll have the child do it to me first. I'll say, why don't you do it to me? I'm going to show you what to do, and you do it to me, and the child laughs, and then I will do it. This is a great way to free up the rib cage. You take your thenar eminences right along the rib angles, and you just hyperextend. Now she feels like she's going to fall off here. That's why I have the patient straddle the table. And I work my way up. And I'm going to show you with the patient on their, once you straddle the table. Let me show you the other way.
Is the child on mom's lap?
Yes, absolutely, absolutely, absolutely. Now notice how much hyperextension I'm able to get. Very, very gently. And she's just stabilizing herself, but I'm able to free up all that rib motion. And in a child, like I said, I make it a game. Very, very easy to do. So a little hyperextension.
Are you doing any lateral?
You can, no, I'm just going straight. I'm just going straight in. Now you don't want to do this. You don't want to make the child sick by doing this. That's not what you want to do. That's not your objective. So you want to be very slow and very deliberate when you do this technique. But my goal is to get just a little bit of hyperextension into the tissue. On asthmatics, works very well. On anybody who has any kind of respiratory condition, works like a charm. And that's why you don't need those fancy OMT techniques. Just the basics are great to utilize. On your back for me, head down here. Yeah. Yeah, not acutely ill. Yeah, somebody in between asthmatic attacks who has a history of asthma, you have them on medication. Yeah, these are great techniques to use. I'm going to show another two, and then maybe we'll split up, and some of my students can help out a little bit. Another great one I didn't talk about, but I love to do is thoracic pumping technique. And probably most of you know thoracic pumping, but it's fun with a child, and this is the way I do it. I don't do a pumping technique like we all learned in medical school, and this was the technique we learned in medical school. Take a deep breath in, let your breath out, and pump, 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 pump. You know, I don't do that. I make it a game, and I do one side at a time. And I'll say to the child, I'll just raise his or her arm up. I'll get on the side of the rib cage, which is just as effective. Okay, I want you to take a deep breath. I want you to say hi to me now. No, keep saying, say hi, 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 hi. And you kind of make it a game. So, and then usually the child will laugh. Take a deep breath for me. I want you to say hi, keep saying hi, hi. Yeah, there we go, good. And it's a great technique and very, very effective for moving the fluids in that thoracic cage. Last one I want to do, and I know most of you know this, but I want you to pretend that your partner's a newborn or a baby. And I want you to take 2 fingers around the occipital-lantal joint. And I want you to add a little compression and a little release. And I want you to see if you can get a release. I want you to add a little compression, a little traction. All of you, or most of you, know this technique, but I don't want you to do that. I want you to pretend your patient is one of your pediatric patients. So I want you to use your index finger and thumb, and I want you to add just a little bit of gentle compression and traction. You'd be surprised at the good release you get. And speaking of that, I'd be remiss if I didn't, sit up for me, if I didn't tell you all my old party trick. And that party trick is for hiccups. And one of my favorite techniques to do for hiccups, and this is for everybody, is hiccups, that diaphragm is not functioning. What's the innervation to the diaphragm? Phrenic nerves, C3, 4, and 5. A great trick for hiccups, and I will tell you it's worked 99.9%. It hasn't worked 100% for me, but 99.9%. If you get your index and middle finger right at C3 or C4, the posterior tissues, and add some compression, some inhibition, pressure, and pretty significant in an adult. I will tell you, people have had persistent hiccups. Within like a minute or two, it'll disappear. So that's my old party trick for hiccups. Somebody's having hiccups, I'm like, ah, I can take care of that. So obviously you could articulate, you could pop C3 or 4 or 5, but this inhibition technique works like a charm. And for a child, let's say a child has you can add just a little bit of pressure at C3, 4, 5, mostly 3 and 4, and get a nice nice correction of their hiccups if they're prone to hiccups. I usually hold it. I will hold it. Well, sometimes the hiccups will disappear even while I'm holding it, but otherwise I'll hold it for about a minute or two and see. Yeah. But on adults, if any of you have hiccups, works like a charm. Or you have spouses or any family members, works like a charm. Okay, on your back for me. So let's see. So what did we do? We did hyperextension. We did thoracic pumping side to side. We did OAD compression. Let's do the cervical fascial technique, and then we'll kind of break. Sit up for me. Face this way. Sorry. Have you up and about. Okay, I want you to put your forearms on top of mine. Good. Yeah, this is perfect. Okay, I want you to take a deep breath. Thumbs above the clavicles. Let your breath out and flex your head for me. Okay. Deep breath for me. And flex your head a little bit more. And my thumbs are going deeper and deeper. Deep breath. Let your breath out. Now last time when you're ready to take a deep breath, I want you to take a full deep breath and bring your head back when you're ready. Go all the way, all the way, all the way. Good. And that will very effectively stretch that intercervical fascia. So somebody who has pharyngitis, asthma will respond very, very well to those techniques. Okay, so let's break up. Yeah. Yeah.
If you're treating a med who is wheezing at the time, do you tend to do most of the parasympathetic techniques first?
Absolutely. And finish with the sympathetic. Absolutely. So I usually, the question was if somebody's in an acute asthmatic attack, what do I focus on first? I do the parasympathetic techniques first. I'll affect that, and then I will go to my sympathetic techniques. So parasympathetic techniques would be, what area would you, anybody? Let me know, yeah, craniosacral, so OA, sacrum, and then I will finish off. The last thing I'll do is my rib techniques. Okay, the nice thing I want you to just to think about, and this is why, well, this is number one why I love OMT so much, but this is why I love treating the pediatric patients. Their tissues are very resilient, and they respond well. They don't have the chronic dysfunctions that everybody in this room has. You don't have a crank in your neck, you got your hip is bothering. They don't have those chronic dysfunctions. They're very resilient, their tissues. So they respond to the simple things. So you think, oh, what's this? This is just a simple technique, but their bodies respond very well because their tissues are still so resilient. They don't have that tissue memory that we all have right now. So what I'd like everybody to do is practice a little bit of the hyperextension